Joining us once again via Skype, Ballad Health Director of Infection Prevention, Jamie Swift. Jamie, thanks so much for your time again, and as always, we appreciate your input. I want to start with the Bristol Motor Speedway. We are hearing from some viewers who are really concerned about, is there going to be a detrimental impact of having so many people coming in from out of town? I know you do not have a crystal ball. None of us do. We lost it a long time ago with COVID-19. But in terms of validity of concerns, do you think it is a valid concern to host an event like this?
I think Bristol Motor Speedway has a really good plan, and I think if we as individuals abide by that plan, then I think we can mitigate some of that risk. The key is going to be, are the individuals participating willing to wear a mask as they're out in the community, not just within that racetrack, but the concern really becomes as they're moving around our community, going to various places. Do they stay the weekend? It's going to be more important than ever that people are wearing their mask and social distancing, regardless of the setting.
You had some big news at Ballad today, and it wasn't the news I know that you wanted to share, that you had a cluster of cases at Sycamore Shoals Hospital that involves not only patients but also staff at the facility. Of course, our best to all of them, and if you could pass that along, we'd appreciate it. But what can you tell us in terms of the severity of the illness? So often when we're hearing about clusters, we hear that many are asymptomatic. What can you tell us about how they're doing tonight?
All of our cases at this point are doing extremely well. So we have had some of the asymptomatic team members. So obviously, as soon as we realized that there could be a cluster, we took that proactive step to go ahead and test all of our team members. So some of those team members that we found were asymptomatic. The patients were already hospitalized, so they are still receiving care. They're still at Sycamore Shoals. They're off the geropsych unit. They are in a isolated wing and being cared for by dedicated staff. So certainly they're separated and not on that geropsych, and to date everyone's doing really well.
That's good news. You're in a hospital setting where they are on alert, where there's PPE, there's all extra efforts at sanitizing, and you still had a cluster. Do you have any idea how in a hospital setting, and we're not talking about a restaurant or a store, we're talking about a hospital, how could you get a cluster? Any idea how it happened?
I think there's a couple of things. So as we shared today, there's about 20% of healthcare workers can be affected, I think CDC says. So it's really important that mask wearing, this setting in particular, masks can't be placed on geropsych patients. So certainly that increased risk. And so really that mask to mask encounter is what's absolutely most important. The key is what we're doing as far as screening and masking, everyone coming in, making sure that we're looking for these cases. And like this, as soon as we found one, we react, we put measures in place and try to control any spread.
Driving so much of this is the real need to not overwhelm hospitals. And late today, I know Ballad Health has said that they're moving some assets from Hawkins County and Hancock County, moving patients to Kingsport. Are we in an area that concerns you when it comes to capacity to be able to handle the incoming care?
The rate at which our hospitalizations and cases are going up is concerning. And so that's why, this is exactly why we have our Emergency Operations Center. As we see this, we can see that if we stay the same, we're not going to be able to handle these patients. So we're taking action now to move staff, open capacity, get those beds open, so that we don't get to the point that we can't handle the patients. So, everything's working. Emergency operations, our job is to look at what's coming, what can be worst case scenario, and how do we mitigate that. So I feel like that's exactly what we're doing in this situation.
Jamie, you're hearing this. We certainly are. There is a tremendous amount of distrust in the data, distrust in the numbers. A lot of people just don't feel like they're getting told the truth. And one point of concern and question is about the rate of false positivity. What can you tell people based on your position in infectious disease? Is there a real possibility that many of these positive cases we're hearing about actually aren't positive, they're false positives? What do you believe is the truth about that?
Typically what you've seen in false positives have been certain facilities or agencies have gone out and gotten a private lab and have sent those tests off. I can tell you that the labs that Ballad Health is using, we use that PCR test, and that's the golden standard of testing. It is extremely rare that you would ever get a false positive on a PCR test. So I am confident in our numbers. I can tell our community. I am being completely transparent with our numbers. We're reporting each case. Each case only gets reported once, and we are being the source of truth for the region.
Jamie Swift with Ballad Health, thanks so much. And again, best to your team members who tonight are working to feel better. We appreciate it.
Thanks.
Thanks so much.